All right, hello. So today we're going to talk about BPH, and that stands for benign prostatic hyperplasia. Another way is benign prostatic hypertrophy, and those are just fancy doctor words that we can't even agree on. That means your prostate's getting bigger, but it's not a cancer. Uh, and so this is a common thing. This is the most common reason that men come to the urologist. I think it's something like 40 million men in the United States have BPH. Um, and the way that we generally find out that a man has BPH is that he's having bothersome symptoms. Um, the most important thing that we can do for you, generally speaking, is to take care of your bothersome symptoms. And anything we do on this topic, or except for extreme outliers, which we'll talk about, but anything we do on this topic, really, it should be up to you and it should be worth the thing you're doing. Okay. So if you don't want to take a medicine every day and you're dead set against it, and it's the symptoms you're having are not bothersome enough for you to take a medicine, then don't take the medicine. Unless there's like a red flag, and I'll tell you what the red flags are. But if there's a procedure, we're talking about doing a surgery, and the idea of anesthesia and a catheter and everything like that is something that's not worth it, then don't do it. It's totally up to you. It's all about the vast majority of the time. This is all about bothersome symptoms. Now, at the same time, you have to be reasonable. If the symptoms are bothering you, then you need to be honest about it. I have many, many men, and they will come and their spouse will be with them, and they will say, oh, they're not bothered, because when you start talking about prostate, especially procedures, men will lie, cheat, and steal before they have something done to their prostate, and they'll say, no, it's not bothering me, but then the spouse will be there, like, he complains about it all the time, he's up all night, he's wearing pads, like, we need to do something about this, it is definitely bothering him, he's not telling the truth. So you have to be honest about it, but as long as you're honest about it, it's about how bothered you are. It's not necessarily about the size of the prostate, for sure. It could be a small prostate and be totally block you completely. It could be a giant prostate and cause you no problems. The prostate size really is largely a technical thing for me to deal with, and getting this sorted out and letting you know what the options are. So I have a little PowerPoint here. I'm going to make myself smaller. All right. So, again, the prostate, it's not something that we really have a good familiarity with of exactly what it is, even though we're always talking about it. It's rare you actually see a prostate picture in day-to-day life. So here it is. So on the left, you have kind of a normal prostate, and that's sitting below the bladder. The bladder is on top, and then the prostate's below, and that tube in the middle is the urethra. On the right, you have enlarged prostate, and this is a benign condition, generally speaking. Prostate cancer doesn't cause diffuse enlargement. It doesn't cause obstruction until it's really, really late. If you're having your PSA screening appropriately, you're probably not having these symptoms due to prostate cancer. This is a benign condition, generally speaking. So you can see that tube in the middle is really getting pinched off from the bladder, and that is the prostate, crushing it. And so what that causes, obviously, is just looking at it, is there's a weak stream, an inability to empty your bladder completely. And that can end up with things like urinary tract infections, bladder stones, and needing a catheter and stuff like that. So those are the obvious signs of BPH. Now, if you have a weak stream, again, you be honest about it. If you have a weak stream and it's just sort of weak, it's not the way it was when you were 20 years old, but you're in and out of the bathroom in a reasonable amount of time, there's nothing else going on, and you don't want to take a medicine, then fine. If you have a weak stream and it takes you 5 full minutes to go to the bathroom, 5 guys in the urinal next to you are filing in and out while you're going to the bathroom, you feel like you're not emptying, then, you may need to do something about that. So those are the obvious kind of consequences of BPH. This next slide, I wanted to talk to you about kind of the other things we talk about with BPH and why. So on top of the obstructive symptoms, there's a whole class of symptoms we call irritative symptoms, and that is getting up all night, running to the bathroom, because if you don't run, then you're going to have an accident, and having to go to the bathroom all the time. So some of those symptoms can be from obstruction where you're not emptying your bladder completely, and therefore you're having to go often because you're just getting a little amount out each time. But mostly when men have those symptoms, it's due to this process called detrusor hypertrophy. And that's another big doctor word. That means your bladder is getting thick. It's like going to the gym. You go and work out your muscle. The bladder is a muscle too. So you're working it out. You're pushing. It's pushing against this resistance. It's pushing against this prostate. And so what does the muscle do? It thickens up. So when you're going to the gym and you're getting swollen, the big biceps, that's good. We want that, but your internal organs, we don't want that. Okay, your heart muscle, and your bladder muscle, we want to lower the pressure. We want to lower the workload because you get one, and you don't want to have a problem with this internal organ. You want to make its life easy. And so if we don't do that, you get this detrusor hypertrophy. So on the left, you can see normal. On the right, you can see this thickening of that shell at the top. So the prostate's in yellow at the bottom and the bladder's on top of it. And you can see that the outside of it is very thick, and that's the bladder muscle thickening. So when you have that thickening happen, you have less capacity. You have to go to the bathroom more often because it doesn't fill as much. You also get stronger signals. So your bladder sends several signals when you need to go to the bathroom. It's like, in order of convenience, like you have 2/3 of your bladder full, it sends you a gentle reminder, hey, next exit, make the off ramp or whatever, find a rest stop, get food at the same time, make it convenient. If you're like 85, 90% full, it's like, okay, buddy, like what's going on? We got to find something. If you're 100% full, that's when it's like, okay, stop the car, we're going in the bushes. Well, if your bladder looks like our friend on the right, you go from 0 to 100. You go straight to, got to get off, got to stop the car, get right out, because that bladder, when it sends a signal, it's going. It doesn't know anything else. It's just so strong at that point. It is just going. And it gives you that urgency that you have to go. And that is probably why men get up all night too. There's a lot with getting up at night that we don't fully understand because we're talking about sleep at that point, and sleep is this whole mystery. But there is this kind of center in the midbrain that, we lose the cerebral cortex inhibition. And so now your brainstem is in charge, and it feels that signal from the bladder, and it says, get up now. And go to the bathroom. And then you go and it's just a little amount. So these are the things that we see with BPH. So those are the symptoms, getting up at night, having to run to the bathroom, having to go to the bathroom all day, weak stream, inability to empty your bladder, recurrent infections, and bladder stones, generally are the things we see. And so when I first meet you, I'm probably not, if you want to talk about surgery and you bring it up, I'll talk all the surgery. I love surgery, but I'm probably not going to talk too much about surgery. Probably going to talk about, a medicine. And generally that medicine is Flomax. There are other medicines in that drug class, but Flomax tends to be one that we've studied extensively. It's generic, it's safe, it's inexpensive, and it works quickly. So Flomax works within 24 to 48 hours. It's a once-a-day pill. And what it does is it relaxes the prostate fibers so that the urine can flow through easier. It doesn't shrink the prostate, it just relaxes the prostate. So it hasn't been shown to definitively stop the need for surgery in long-term studies. It has been shown to delay the need for a long time. And so about 85% of men over the age of 80 are on some medicine for BPH like this. So it's extremely common. It is a normal part of aging. Most men will say, well, okay, like I'm just aging and this is normal. That's true, but you don't need to be miserable and you don't need to have like catastrophic consequences of your prostate getting swollen, like needing a catheter, and then you're stuck with the catheter. And we're doing all this preoperative workup and staging of your prostate while there's a catheter in place. We can get ahead of that. And you shouldn't think of it either in the same way as you're now sick. It's not that you're sick. It's normal. It's normal. It's like a supplement, basically. These medicines, especially these few that I'm going to talk about, are safe, effective, inexpensive, and most men are on them. It's just part of life. So that's Flomax. We usually talk about that because it's effective and safe. Just so you know, things with Flomax, there are some general side like runny nose and stuffy nose and stuff like that. But the ones that are, we really do kind of worry about or talk about is low blood pressure and then retrograde ejaculation. Those are the ones that we really care about. So low blood pressure is a class effect. This is actually Flomax, even though it's generic and been around for a while. It's a second generation from an older generation. The older generation lowered everybody's blood pressure. It was a blood pressure medicine. This does not generally lower blood pressure. There's kind of a nuance to the receptor and the blood pressure receptor and the prostate receptor that they found, and we're able to work just with the prostate. But there is still some cross reactivity. So about 1% of men will experience significant low blood pressure. And what that is like when you stand up, you get dizzy. So I recommend to patients, when you're first starting this medicine, take it at night before you go to bed. If you have to wake up during the night, just let your legs hang over the side of the bed for a couple minutes before you stand up. So that's the one thing. And then retrograde ejaculation happens about 25% of the time, and it is reversible. So what is retrograde ejaculation? That is, you have a normal erection, you feel an orgasm, but then nothing comes out. And that's because the medicine made the path of least resistance for the ejaculate to go backwards into your bladder. You pee it out later and it's harmless, but if that happens to you, just stop the medicine and it'll go away. So that's Flomax. The next medicine that I do talk about with regards to BPH, especially if I have an exact size from a scan or an ultrasound or something like that, is finasteride. Finasteride is a medicine that shrinks the prostate. It has been shown to definitively stop the need for surgery, as opposed to Flomax that delays it. But the problem with finasteride, there's two major issues. It is inexpensive, it is safe, it is effective, but it takes 6 months to work because it slowly shrinks down the prostate. So if you need relief tomorrow, it's going to do nothing for you. The second thing that finasteride, the problem is it causes low libido and erectile dysfunction. If you look at the studies, de novo, like brand new erectile dysfunction and brand new low libido is about 5% of men. But that's because most men, as they are getting these problems, are also having problems with low libido and erections. In my experience, it's about 50-50 that men have some issue with erections or libido if they're on finasteride long term. But if that's not a problem, then yes, it's a very effective medicine, especially if we have an exact size. We really don't want to do finasteride if it's under 40 grams prostate because it's not big enough to really, the shrinking doesn't do anything. But if it's over that size, it is effective. The other medicine that we may discuss is a daily low-dose Cialis. I do save this one for last because we don't know how it works, but it does work. It looks like it's more treats the irritative voiding symptoms, the OAB symptoms, and works on the bladder than the prostate itself, but we really don't know how it works. We just know that men who are taking Cialis actually get relief when it comes to urinary issues. So that is another option, a low-dose Cialis. You may hear it's $1 million. It's not. The GoodRx program at Publix, it's like, I think a 3-month supply is something like $30. So we maybe need to go that route. Insurances really aren't covering Cialis, but the GoodRx program thankfully is. So those are, and then as far as side effects for that, better erections. I mean, that's one side effect. Some men experience maybe dizziness, but really it is a very well tolerated medicine. It just, for me, doesn't really go to the root of the problem. Probably it doesn't do anything to the prostate itself, so I save that for last. but it's definitely something that can get you some relief. So if you're watching this video, this is probably after your first appointment. I generally, like I said, don't talk about surgery. The next step is to see if the medicine works. If the medicine doesn't work, I then need to kind of figure out what's going on, because maybe we're missing something. I've had men who were seen and given medicine and more medicine and more medicine, and no one checked. And then actually they had bladder tumor so bad I had to remove their whole bladder. So I had that twice actually in a couple of years. So I always check after the medicine. If you're not having relief, I do look with a scope and make sure there's no bladder tumor, make sure there's nothing going on that we missed, and I get an exact size of the prostate. If I don't have one already from a scan, I'll do an ultrasound of your prostate to get an exact size. And then we can talk about other options, surgical options, other medicines, and go from there. But that's basically it. So if you have any questions, please call. But otherwise, I'll see you at your follow-up. Have a wonderful day.